Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Are you looking for ways to prevent cancer? Are some cancers even preventable? You've probably heard conflicting reports about cancer prevention. Sometimes the specific cancer prevention tip recommended in one study or news report is advised against in another. Certainly, what is known about cancer prevention is still evolving. According to the American Cancer Society, there is strong evidence that an individual risk of developing cancer can be substantially reduced by healthy behavior. Therefore, it's well accepted that your chances of developing cancer are affected by lifestyle choices that you make. So if you're concerned about cancer prevention, take comfort in the fact that some simple lifestyle changes can make a big difference. So don't lose hope. Stand by as Get Healthy with Dr. Cooper starts now.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935. Dr. Donna Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonnacooper.com.
Hello everyone, I'm Dr. Cooper Dockery and welcome to Get Healthy. This program is designed to educate you, the viewers, on how to develop and maintain a healthy lifestyle by adopting simple lifestyle habits that will dramatically improve your health. Our topic today is cancer prevention using lifestyle choices. Now, did you know that the National Cancer Institute estimated that in 2014, about 1,665,000 people would be diagnosed with cancer. And of that, about 585,720 people would die from cancer-related deaths. And that about over 200,000 of those diagnosed would be related to tobacco use. Well then, it is safe to say that cancer is indeed preventable. It is believed that more than half of the cancer deaths are preventable. So here are a few simple choices to help to reduce your risk of various cancer. Number 1, do not use tobacco. Using any type of tobacco puts you on a path to develop cancer. Smoking has been linked to various types of cancers, including lung, mouth, throat, larynx, pancreas, bladder, cervix, and kidney. Chewing tobacco has been linked to cancer of the oral cavity and pancreas. Even if you do not use tobacco, exposure to secondhand smoke might increase your risk of lung cancer. Deciding to quit using tobacco is the most important health decision you can make. It's also an important part of cancer prevention. If you need help quitting tobacco smoking, ask your doctor about stop smoking products and other strategy for quitting. Number 2, eat a healthy diet. Although making healthy selection at the grocery store and at mealtime can't guarantee cancer prevention, it might help reduce your risk. Consider these guidelines. Eat plenty of fruits and vegetables. Base your diet on fruits, vegetables, and other food from the plant source, such as whole grains and beans. Increase the consumption of antioxidants will improve your body's ability to fight cancer. Scientists believe that cancer cells slowly grow in the blood of patients who are vegans than in the blood of people who consume animal products. In addition, the cancer prevention study shows significant cancer risk suppression in patients who consume cruciferous vegetables, fruits, and whole grains. Avoid the intake of alcohol. The risk of various types of cancers, including cancer of the breast, colon, lung, kidney, and liver, increases with the amount of alcohol you drink and the length of time that you have been drinking regularly. Limit the intake of processed meats. A report from the International Agency for Research on Cancer, the Cancer Agency of the World Health Organization, concluded that eating large amounts of processed meat can slightly increase the risk of certain types of cancer. In addition, women who eat a Mediterranean diet supplemented with extra virgin olive oil and mixed nuts might have a reduced risk of breast cancer. The Mediterranean diet focuses on mostly plant-based foods such as fruits, vegetable whole grains, legumes, and nuts. People who follow the Mediterranean diet choose healthy fats like olive oil over butter and fish instead of red meat. Number 3, maintain a healthy weight and be physically active. Maintaining a healthy weight might lower the risk of various types of cancer, including cancer of the breast, prostate, lung, colon, and kidney. Physical activity counts too. In addition to helping you control your weight, physical activity on its own might lower the risk of breast cancer and colon cancer. Adults who participate in any amount of physical activity gain some health benefit. But for substantial health benefit, strive to get at least 150 minutes a week of moderate aerobic activity or 75 minutes a week of vigorous aerobic physical activity. You can also do a combination of moderate and vigorous activity. As a general rule, include at least 30 minutes of physical activity in your daily routine. And if you can't do that, do even more. Number 4, protect yourself from the sun. Skin cancer is one of the most common kind of cancer and one of the most preventable. Try these tips. Avoid excessive exposure to the sun. Obtaining about 10 to 15 minutes of sunlight between 10 a.m. and 3 p.m. allows for an adequate daily amount of vitamin D. Remember to stay in the shade. When you're outdoors, stay in the shaded area as much as possible. Sunglasses and a broad rim hat can also help too. Cover exposed areas. Wear tightly woven, loose-fitting clothing that cover as much of your skin as possible. Opt for bright over dark colors, which reflect more ultraviolet radiation than pastel or bleach cotton. Avoid tanning beds and sun lamps. These are just as damaging as natural sunlight. Maintaining an adequate amount of vitamin D is very important. Vitamin D is a prohormone that is responsible for gene modulation. Adequate level of vitamin D is essential to reduce gene mutation and thus the transformation into cancer cells. Number 5, get immunized. Cancer prevention includes protection from certain viral infection. Talk to your doctor about immunization against hepatitis B. Hepatitis B can increase the risk of developing liver cancer. The hepatitis B vaccine is recommended for certain high-risk individuals, such as adults who are sexually active but not in a mutually monogamous relationship, intravenous drug users, healthcare providers, or public safety workers who might be exposed to infected blood or body fluids. Human papillomavirus. HPV is a sexually transmitted virus that can lead to cervical cancer and other genital cancer, as well as squamous cell carcinoma of the head and neck. Avoid risky behaviors. Practice safe sex. Don't share needles. 7. Get regular medical care. Regular self-exam and screening for various types of cancers, such as cancer of the skin, colon, cervix, and breast, can increase your chances of discovering cancer early when treatment is most likely to be successful. Ask your doctor about the best cancer screening schedule for you. Mammogram. Women age 40 and above should have a yearly mammogram, and this should continue as long as that person is in good health up to about age 70. Screening for colon cancer should be done at age 50. There are various techniques that can be used. Colonoscopy, that is done every 10 years, or flexigmoidoscopy, that is done every 5 years. Pap smear. All women should begin cervical cancer screening at about the age of 21. This should be continued yearly until about the age of 65. Other health tips. Individuals should check their skin for moles that are new, large, irregular, or contain more than one color, or change in color. Take cancer prevention in your hands starting today. The rewards could be lasting. Don't go away. We'll be right back with more information on cancer prevention.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Donna Cooper and her team are ready to help. To order her books or the DVD series, Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonnacooper.com today.
Welcome back. Today in our show, we have been discussing healthy lifestyle and the impact on overall health, especially cancer prevention. And today in our program, we have Dr. Doris from Mercy Dental in Edinburgh, Texas. Doctor, welcome.
Thank you. It's a pleasure to be here.
Very good. Now tell me, is there a relationship between healthy lifestyle and dental health?
Oh, yes, definitely. A well-balanced diet is very important for oral health because our mouth is our first point of contact where we consume our food. So our eating patterns and our food choices has a direct impact to prevent tooth decay and gum disease.
Very good. Is there any particular fruits or vegetable you'd suggest that we eat to maintain good oral health?
I always recommend to have those vegetables has higher content in water, such as carrots, celery. They help to wash away the food and also to help the teeth stay clean.
Very good. Now, in our show today, we have been emphasizing lifestyle and prevention of cancer. What do you have to tell us about oral cancer?
Oral cancer is not different to any cancer in your body because I always tell my patients you need to listen what your body telling you. Every time you have any changes, especially in your mouth, any change in color, in consistency, if you have any lesion that lasts more than 10 to 14 days, you need to really have it checked to the dentist.
Very good. You know, a lot of my patients, I'm an internist, they are very fearful when they find an ulcer in their mouth. How do you advise those patients with ulceration in any part of the mouth?
Oh, we get that a lot. Patients who have ulcer, we always tell them how long it's been there. And it's always been, if it's more than 2 weeks, we have to do a biopsy to further investigate. We don't want to let it pass by because now oral cancer screening is part of a new standard of care. Any patient who goes to the dentist needs to have that exam done every time.
Very good. And how often do you recommend a patient sees his or her dentist?
We recommend to see the patient to see dentist twice a year, every 6 months. But if any time they feel like they have any concern, then they should not hesitate to go.
Very good. And I'm sure we have a lot of mothers and fathers out there. How do you recommend to these mothers and fathers in terms of what they should do with their kids for them to maintain good teeth?
I think also they need to try to maintain a good oral health by brushing and flossing daily, and also watch what they're giving to slow down in the sugar intake, such as soft drink or soda, and changes by adding vegetable and fruit to their diet.
Very good. Dr. Doris, I thank you so much for being here with us.
It was a pleasure.
And I'm sure we'll invite you again.
Anytime.
Very good. Thank you.
Thank you.
Don't go away. We'll be right back with more on cancer prevention and lifestyle modification.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935.
We're back in the kitchen today with Maribel. What are we preparing today, Maribel?
We're gonna make some walnut balls. And these are wonderful for now the holidays. It's a great opportunity to be able to share such a great recipe with your family and whoever you're gonna be having over.
Right, so these are walnut meatless meatballs.
Meatless meatballs, that's
Are they
correct.
very tasty?
Awesome, my patients loved it. We prepared them all week.
Excellent. Well, why don't you go ahead?
Well, what we want to do is, first of all, let you know everything's going to happen within our pot. So we went ahead and you can either put 4 cups of vegetable broth or 4 cups of water and just bring everything to a boil, which we pretty much are at. Let me get rid of this and do it afterwards. We're going to start adding all our ingredients. We have 1 cup of walnuts.
Very good.
Sorry.
And you know, walnuts are high in protein.
And omega-3s, yes.
Okay.
And we're gonna add half a cup of unsalted, untoasted, those are the raw sunflower seeds.
Excellent.
Just add it, and we're gonna put a whole onion, chopped onion. So we added our onion, and it's boiling.
Next.
We're gonna go ahead and proceed by adding half a cup of vegetable or olive oil.
And you can cut back on that. It doesn't have to be half a cup. It could be a quarter cup. Yes.
We're gonna do our raw garlic or garlic powder.
And you know, garlic is very good for the immune system, so feel free to put extra garlic there.
That is correct. We're gonna put 1/4 cup of yeast flakes.
And this is nutritional yeast, which is filled with vitamin B12.
1 teaspoon of our coriander.
Very
1
nice.
teaspoon of our sage. 1 tablespoon of our Italian blend. Just get it all in there.
Very good.
And we're gonna put a tablespoon of molasses. You can put them dry, or you can also find them in the bottle,
The liquid.
the liquid.
Very good.
Bring everything to a boil. And the last ingredient that we're going to add are 4 cups of old-fashioned rolled oats.
And you know, rolled oats, this is filled with protein. For 1 cup of oats, you have 29 grams of protein. So don't be hesitant. This is filled with a lot of protein.
And all you're gonna do is mix a little bit, remove from the stove, and leave it covered for 30 minutes.
Very good.
After 30 minutes, we start.
Are we
taking
gonna add
our
that?
balls. I'm sorry, yes. We're gonna add our half a cup of soy sauce. Thank you, doctor.
Very nice.
Go ahead and add our half a cup.
And that gives it the extra flavor, as well as some, if you use the, not soy sauce, but the amino acid.
Aminorex.
Yes.
Aminorex, yes.
Then you're getting extra amino acid, the building block for protein.
And we're gonna go ahead and show you the prepared or the cooked, and we'll go ahead and start making our
Meatballs.
meatballs.
Okay, go ahead.
We're gonna go ahead and use our slightly oiled cookie sheet, and I have found very helpful to use my tablespoon measurement, and that gives you the exact size that they will all come out to.
But of course, if you want to make bigger
balls or hamburger.
you can make them in a larger size, of course.
That is correct. We're gonna be cooking these meatballs for 20 minutes on each side.
Very nice.
We go ahead and press them, and like doctor says, we can make them bigger, or you can even make, there we go.
Very nice. And you know, Maribel, I like to do this when I'm having guests.
Yes.
And my guests, some of them are not vegetarian, but when they eat these balls, they taste exactly like meat. All right, go
That
ahead.
is correct. And this morning we cooked them for our patients, and what I did was I served them as hors d'oeuvres, and just have them try both. With marinara sauce is a good suggestion, whether you have the spaghetti or just the hors d'oeuvre, and with barbecue sauce.
Very good. Do you have some prepared already,
Yes, I
Maribel?
do.
Why don't we bring those out?
Yes, ma'am.
All right.
So we're gonna cook these balls. Don't forget 20 minutes on each side.
20 minutes on each side. So we have some prepared for you. So if you have children and you want to do this with spaghetti, then you have it right there. It's very delicious. Or you can have the barbecue one. I love this. But if you're diabetic, then try not to use the barbecue. Go with the marinara sauce. Maribel, I think this looks delicious.
I think it is, doctor, and most of our patients, well, we had a vote and there was a split. Some of them really liked it, and like I said, I served them with just the sauce, and they loved them. So go ahead and surprise your guest on this holidays.
Very good. So for more recipe, go to our website, www.gethealthywithdrcooper.tv. Thank you, Maribel.
You're welcome, doctor.
Welcome to Get Health with Dr. Cooper. Do you have diabetes and want to get rid of it, or high blood pressure and want to improve your blood pressure? Then we have something special for you. Active living 30 minutes a day or 60 minutes a day will cure your diseases. Ramsey, what do you have for us today?
Hello, Dr. Cooper. You're right. I like that explanation. What we have today is just going to be an exercise with resistant bands, going to focus on the lower body. We have our beautiful ladies here just to show us. What we're going to mainly focus on is just going to be 5 exercises. We're really going to focus on the front squat right here. We're going to use a little bit more abdominal muscle. To sustain us here, we're going to have the girls bring the resistant bands all the way up, drop all the way down. Let's go. We're gonna get a good 5 in. Here, we really wanna focus on bringing that butt as low as possible and keeping that back straight. Keep that back straight. Don't try to lean too much, especially with this exercise. We do have the instance to lean a little bit more, but just try to sustain yourself and go as low as possible. For some of us, we can't go that low, so again, push yourself to go as low as possible. We're gonna go at least 15 to 20, 4 sets. 4 sets total, 15 to 20. Now the next one, we're gonna do a straight leg deadlift. Straight leg deadlift with resistant bands. We're not using any weight in this. All we're doing is going down as low as possible, keeping the legs straight, coming up. Not everybody has the same flexibility, so try to push yourself as much as you can. It's not easy, but try your best. Again, we're gonna go 15 to 20, 3 to 4 sets. 3 to 4 sets. Depending on how you can, it also depends on the economy of what you can do. Just try to push yourself as much as you can, okay? Now what we got is a single leg kickback. Just bring it back. Same thing, if you feel comfortable with your hands on your hips, do it with your hands on your hips. If you feel comfortable with your hands up in front of you, do the same thing. There you go. Here, 15 to 20, we're just trying to get that muscle conditioning back into play. We're just trying to get our muscles back under us. 15 to 20, 3 to 4 sets. There you go. And don't forget, we got both legs, 15 to 20, 15 to 20, both legs. There you go, there you go. All right, now we got side steps. We're gonna try to be, all we're doing is just going to the side, stepping, go ahead Denise, come to the left. Step, there you go, step. Cynthia, go to the right, there you go. Now go back, Denise, boom. Wait, there you go, good job. Now if you can't go as low as possible, push yourself, go back. There you go. If you can, go as low as possible, but if you can't, just do as much as you can. Try to emphasize that step. Try to wind it out as much as you can. Give me one more, ladies, one more, just so everybody gets a good look on what we're doing. There you go, nice and controlled, nice and controlled. If you can stay low as long as possible. I know you're gonna wanna come up, but try to push yourself to stay low. Here we wanna do it a good, if we're gonna go in distance, we wanna go at least 20 yards. If we're doing it in how many repetitions we do each leg, we wanna try to focus on 15 repetitions each leg, right and left. We're trying to do that a good 4 times. This is really gonna kick your butt, so be careful on how you do it. Try to focus yourself on not arcing your back or leaning too far forward. Really try to just sustain yourself and go as far as you can. And that's our segment for today. Dr. Cooper, thank you for having me. This was quite an experience.
Thank you, Ramsey. Thank you. I notice they need a lot of balance for this exercise, right?
Yes.
So,
a lot of core.
there you go. You out there, if you have difficulty balancing, just go slow. And remember, if you want to live a long and healthy life, you must move. Exercise is important for good health. We'll be right back. Don't go away. The word cancer causes stress and anxiety in many people. However, it is not the will of God that we suffer pain, death, or diseases. Friends, God wants us to enjoy good health, peace, and prosperity. Our Bible text for today is found in 3 John 1:3. Beloved, I pray that you prosper in all things and be in health, just as your soul prospereth. If you'd like to learn more on how to live a full, happy, and healthier life, visit our website, www.gethealthywithdrcooper.tv or www.cooperwellnesscenter.com.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website at drdonnacooper.com.